Welcome, my name is Dr. James Ward. I'm a GP in Burntwood and the locality director for Lichfield. I will be talking you through the slides today on our public consultation. Our public consultation is taking place from the 22nd of September through to the 6th of November. As a CCG, we have a responsibility to commission and buy services that are safe, effective and offer value for money. Unfortunately, the CCG has a large financial deficit and we have a legal and statutory obligation to deliver a balanced budget. Last year we spent around £16 million more than our budget. We do not have the ability to do nothing in the face of this. It is really important to us that you give us your opinions during this public consultation. The NHS is in the middle of a 10-year funding squeeze. For the last 5 years it has had uplifts to its funding of just above normal inflation. However, it faces a number of challenges. Life expectancy is increasing, the population is growing and people are living older with more long-term conditions. This creates a massive pressure on the front line of health services. Demand for urgent healthcare in particular is rising. This slide describes our current financial situation. As I mentioned, the CCG spends £16 million a year more than its budget. The NHS does not expect us to stop spending the £16 million straight away. Each year we must deliver £6.5 million of savings for the next 3 years. This is going to be a significant challenge. Doing nothing is not an option. We are all consumers of healthcare. As you can see on this slide, we have laid out some of the costs that the health service runs in delivering services to you. You can see that a GP appointment costs between £30 and £40, and importantly for this consultation, a minor injuries unit attendance is approximately £56. This is roughly equivalent to a simple A&E attendance when no investigation or intervention is required. You can see at the final point, a hip replacement costs a significant amount of money and can be much more than this if there are complications. I'm going to bring us back to the £200 million budget I mentioned previously. You can see there are huge numbers of these procedures going on each year for our population. As clinicians and throughout the CCG, we are committed to an ongoing, open and honest communication with patients. We've held a number of events over the last 18 months where we listened to the public, and you can see a number of the key themes that have been highlighted. People understand that we need to change how we run our services. People get frustrated by access, whether that's to the GP or long queues for outpatients or busy A&E departments. We all know that good communication is the key to success, but patients in particular want to see people being able to manage their condition themselves and see clinicians deliver high quality education and information to patients so that they know and understand their condition. We have highlighted several key areas in bold on this slide. Another area that's really crucially important and frustrates everybody who uses and works in the health service is the efficiency and waste reduction that we need to see to save not only money but time and energy of both patients and staff. Patients use the health service very differently. Here we have tried to describe what we feel urgent and emergency care means for people. Somebody with a chronic condition who suddenly deteriorates, or someone who's normally healthy who has an accident or suddenly becomes unwell, needs to know how they can get help and where they can get help from. Unfortunately, urgent care services are often disjointed and run in parallel. This confuses people and sometimes means people go to the wrong place at the wrong time. Minor Injuries Unit is a facility designed to see, treat and discharge patients who have simple injuries, be those muscle sprains or suspected broken bones. They do not operate an appointment system and patients turn up and await to be seen. Minor Injuries Units are based at Samuel Johnson Hospital in Lichfield and the Robert Peel Hospital in Tamworth. Both services are nurse-led and are currently open 24 hours a day, 7 days a week. Over 65,000 people attended the two sites during the last year, This cost the health service around £3.8 million. You can see from this slide that neither the X-ray or pharmacy is open in the same opening hours. As a CCG, we have one of the highest rates of A&E attendance in the country. Patients use the minor injuries units for a number of things, and over the years the role has developed into treating also minor illnesses. The units were not originally set up to do this. As you can see from the statistics at the bottom of the slide, half the attendances are when X-ray is closed, so people cannot get the full assessment should they have an injury to an arm or leg. Many of the attendances could have been treated through other organisations such as a pharmacy or their local GP practice, and nearly 20% is for follow-up visits. Before putting our proposals out to public consultation, we performed a detailed analysis of the activity in both units. This analysis focused particularly on the overnight period. As you can see, very low numbers of patients attend, with one patient every 2 hours being an average. Of these patients, 1 in 4 are then referred on to another service such as the GP out-of-hours service or A&E. This is largely because the units do not have the right kind of support facility such as X-ray and pharmacy to facilitate their immediate care. Changing the opening hours of the minor injuries unit will save approximately £300,000 a year, and this will soon add up to a significant saving. As we developed our proposals, we considered a number of options, including whether or not the units should be closed altogether. Our preferred response is to change the opening hours of the minor injuries units to 8 AM to 9 PM, 7 days a week. We want to ensure our patients are seen by the right person first time. We need to save money and make sure our services are cost effective. Making this small change to the opening hours of the minor injuries will ensure we can save much needed resource. The change will only affect a small number of patients using the units overnight, and patients can be seen elsewhere safely and promptly. To help us understand and listen to your views, we have created an information booklet which is available at GP practices and some community venues across the area. We want to encourage everyone to complete the survey, either by posting the completed survey to Free Post MIU or preferably online. You can access this through the CCG website. We are also holding a number of drop-in events in both Tamworth and Lichfield. Finally, if you remain uncertain as to how to best access services locally, please remember you can call the 111 service, where you'll be able to speak to a highly trained advisor who can point you in the right direction first time. Thank you very much for listening.